pleasure to have both of you here to make some very important announcements as it relates to funding for Mackenzie Health and the Cortellucci Vaughan Hospital. So Minister Lecce, I will turn it over to you first.
Alrighty. Well, thank you very much, Altaf, and thank you, Daisy. It's brilliant to be joined with Daisy Way, an incredibly hardworking MPP from people of Richmond Hill. Daisy and I both share this wonderful Mackenzie Hospital, both at the Cortellucci Vaughan Hospital here in the city of Vaughan, as well as the Mackenzie Health Hospital, the original hospital in Richmond Hill. So Daisy and I are wonderful partners and great champions of Mackenzie Health, and we're so grateful to the 2,500 staff who work every single day on the front lines to provide excellence and quality care to families in our region and in our communities. Today I just want to underscore that this pandemic has been incredibly difficult on families, and throughout it all, the constant, the enduring truth has been the bravery, the courage, and the selflessness of Ontario's frontline healthcare workers. And that has been so true, so evident by the great compassion and kindness and hard work of the staff at Mackenzie Health. We are so proud of them, we are so grateful. At a critical time in our history as a province, in the first in over 20 years, a net new hospital was opened that the Premier, the Minister of Health, Daisy and I, and others opened really at some difficultest times in human history, or Canadian history. It was a lifeline. It stepped up to provide care for folks, particularly those who were dealing with COVID-19. And of course, the hospital transitioned back to the community-based hospital it was envisioned to be. And over that period, it has been responsive to the needs of so many patients, so many residents that require care. One of those residents right now, in fact, is my own grandmother, who is within Cortellucci Vaughan Hospital today. And just seeing the level of commitment of the staff over the past 3 weeks, it's been really wonderful, and it's been a great blessing to know that there's this type of commitment to the welfare of residents, particularly our seniors. And I just want to thank Mackenzie, I want to thank you all, I want to thank all the staff for doing the very best in a difficult circumstance and really supporting some of the most vulnerable in my community, including my wonderful 97-year-old grandmother as we speak. So it is very personal for many of us that have had to use hospitals over the course of the past years, and this partnership could not have been done without the hard work of our frontline staff. In order to enable our frontline staff to do the good work, in order to keep families safe, to get through this pandemic, funding has been critical. And today, Daisy and I are very proud to announce $19.8 million in additional funding for Mackenzie Health. This funding has, over the course of the pandemic, been critical to enabling staffing, vaccination clinics, as well as other types of infection prevention measures to reduce risk, to save lives. And the $19.8 million, part of a broader $696 million fund, is going to help hospitals in this province at a critical time. And that's what it's done over the past year. It's what it will continue to do as staff at Mackenzie Health continue to step up to provide excellence in care. So we're proud to do this, we're excited to announce it, and most especially we're so grateful of the partnership with Mackenzie, with the province of Ontario, with our government. And with that, I'll turn it back to Altaf for additional words. Thank you so much.
So thank you so much, Minister Lecce. Again, your support for Mackenzie Health and Cortellucci Vaughan Hospital has been instrumental over the last number of years. And to MPP Daisy Way, your support at the Mackenzie Richmond Hospital and your support even before you became an MPP and served on the board of Mackenzie Health has been instrumental in guiding us towards our future state and what we are today, which are two vital hospitals to this growing community. As you can appreciate, funding is critical to delivering healthcare and in particular hospital services. And as we've continued to grow, the government has continued to support us with the necessary funds to meet the needs of this growing community. So our two hospitals, Cortellucci Vaughan Hospital, Mackenzie Richmond Hospital, our RCC, and our network of community-based locations are funded by a government that absolutely understands the need for appropriate funding, adequate funding when it's needed. Obviously, the support of the government to open Cortellucci Vaughan Hospital, you can see the significant increase in budget that we've received to open the first net new hospital, as Mr. Lecce has said, in this province in over 30 years. So the support obviously for the construction dollars, but also for the operating dollars has been instrumental. The government absolutely appreciates the pressures that all hospitals face. Our two EDs are incredibly busy. We see upwards of 600 patients a day across both sites and our urgent care center. And clearly, the funding for the emergency department, the beds, the staff are all crucial. Just a little over a year ago, we opened Cortellucci Vaughan Hospital. We opened on February the 6th, and we opened as a pandemic response hospital. The last 2 years have been incredibly difficult for our community, for our staff, for our patients. And again, the government has continued to step up and support us. So we opened in a very unique way. We became a response hospital for all the other neighboring hospitals. We cared for over 500 patients from the neighboring hospitals to really enable us to get through the third and the fourth wave of this pandemic. And I think without Cortellucci Vaughan Hospital serving the needs of the other hospitals, we probably wouldn't have gone through those trying third and fourth waves. And then on June the 6th, we opened as a full-service hospital. And that was quite amazing in terms of how we opened. I still remember that day. Minister Lecce was there, our MPP Daisy Way was there, and we delivered 2 sets of twins. A remarkable story. Those were the first babies born at Cortellucci Vaughan Hospital. And that family had their very first baby at Mackenzie Richmond Hill Hospital. So just a very amazing sort of description of how we have these 2 hospitals serving 2 growing communities, and a service delivery model that really focuses on core services at both hospital, an emergency department, ICU, med-surg beds, operating rooms, and then specialized services across the sites as well. Clearly, during the pandemic, the need for additional resources is critical, and we were able to open many additional services to support our community in this pandemic. We opened 2 assessment centers, we opened additional ICU beds, we opened additional medicine beds. We had funds to support long-term care and congregate settings, over 100 different locations, where we were able to ensure that the appropriate IPAC resources were in there to prevent outbreaks from happening. So what I will say is that the one thing I never had to worry about during the last 2 years of the pandemic was the resources to deliver the care that we needed. The government was always there to make sure we had what we needed, whether it was staffing dollars, whether it was ventilators, whether it was beds. If we asked for it, it showed up the next day. So we are so thankful for the support of the government for getting us through these last 2 years. It was seamless in terms of what we needed, in terms of the support. And then we were just able to do what we do well, which is to deliver care to this growing community. So Minister Lecce, MPP Daisy Way, thank you for all your support. And we really do appreciate what you do for this community and what you do for Mackenzie Health, and most importantly, for the patients that we serve every single day. So with that, I'm now going to turn it over to MPP Daisy Way. Please come to the podium.
Thank you very much, Altaf. It is exciting today. As MPP for Richmond Health, I'm here today to see and announce this great funding that we are going to provide. Good morning, everyone. I'm so excited that we can speak about this government's work funds initiatives alongside with my good friend, our great minister in Vaughan, as well as a great colleague in the House, Minister Stephen Lecce. And of course, I'm so pleased to see President of the Vaughan Hospital. We have Stephen, we have Altaf Stationwala to be here with us today. Thank you very much. This is a touching moment for me, standing in this Vaughan Cortellucci Hospital, making this announcement today. Once again, thank you very much for the hard work of all the staff in the hospital, and thank you very much for your leadership, Altaf. I was here when it was still called York Central Hospital, and I see how it evolves, and now it has 2 hospitals. What a great thing to see, and most importantly, seeing the high quality of care given out to the people in the community of Richmond Hill as well as Vaughan. And all at the same time, thank you, under your leadership, Altaf, you had managed all the finance and make sure that we're running both things in the best shape. Thank you very much to each one of you. Well, during the COVID time, our hospital and the staff has been working so hard, especially those on the front lines. They have used every tool in their disposal to support them during these difficult times. Our government has been working hard with our hospital as well, and you just heard that our hospital partners has been also working hard to ensure that the financial support that they need are there. I'm so happy to hear it from Altaf that when he asks for any resources, they are there the next day. All hospitals have felt financial challenges as a result of the pandemic, which is our government, which is providing over the $1.2 billion to ensure that they can continue to provide the quality care. As part of this, I'm thrilled that Mackenzie Health is receiving almost $20 million to help the recovery. I hope that this will have a great assistance to Mackenzie Health and other hospitals receiving much of this needed funding. And thank you very much all for working very hard, and thank you the care that you've given to the community.